Thank you for joining this training session on hazardous substances. Today we will be diving into crucial information that will help us understand and manage hazardous substances effectively in our workplace. This training material has been meticulously prepared by Ahmad Jafar, the HSE trainer at Hazardous Mining Company. Throughout this session, we will cover various aspects of hazardous substances, including identification, handling, storage, and emergency response procedures. Our goal is to ensure that everyone is equipped with the knowledge and skills necessary to maintain a safe and healthy work environment. Let's get started and make the most of this learning opportunity. If you have any questions or need further clarification at any point, please feel free to contact the trainer directly. Presentation outline. Objectives. Introduction. Procedure. Training evaluation. Exam. Training objectives. Identify hazardous substances. Assess and manage risks. Proper handling and storage. Emergency response procedures. Labeling and documentation. Introduction to hazardous substances. Definition: hazardous substances are materials that pose risks to health, safety, or the environment. Examples: cleaners, adhesives, paints, solvents, pesticides, inks, lubricants, and fuels. Physical status. Solids: these can include powders, dust, and granules. Examples are asbestos fibers and lead dust. Liquids: hazardous liquids can be flammable, corrosive, or toxic. Examples include gasoline, sulfuric acid, and mercury. Gases: these can be toxic, flammable, or reactive. Examples include chlorine gas, hydrogen sulfide, and propane. Vapors: vapors are the gaseous form of substances that are typically liquids at room temperature. Examples include benzene vapor and acetone vapor. Fumes: these are tiny solid particles suspended in air, often produced by combustion or chemical reactions. Examples include welding fumes and metal fumes. Mists: mists are tiny liquid droplets suspended in air, often created by spraying or condensation. Examples include acid mists and pesticide mists. Types of hazards. Health hazards. Acute effects: immediate health effects like irritation or poisoning. Chronic effects: long-term health effects such as cancer or organ damage. Physical hazards. Flammability: risk of catching fire. Corrosive: damage to materials or skin. Explosibility: risk of explosion. Environmental hazards. Air pollution. Water pollution. Soil contamination. Chemical spills. Nuclear accidents. Routes of exposure. Inhalation. Do we breathe it in? This is the most common route of entry. Absorption. Does it pass through the skin, eyes, or other membranes? Ingestion. Do we eat or drink it? Injection. Does it enter through a puncture or cut? Safety Data Sheets, SDS. Purpose: provide detailed information about the hazards of a chemical and how to handle it safely. Key sections: identification, hazard identification, composition, first aid measures, firefighting measures, accidental release measures, handling and storage, exposure control/personal protection, physical and chemical properties, stability and reactivity, toxicological information. Distribution and posting locations. Work areas: post SDS in areas where hazardous chemicals are used or stored. Accessible locations: ensure SDS are easily accessible to all employees, such as in break rooms, near chemical storage areas, and on the SharePoint. Emergency response stations: place SDS at emergency response stations for quick reference during incidents. Waste collection areas: post SDS in waste collection areas where contaminated containers of chemicals are collected to ensure safe handling and disposal. COSH assessment. Definition: COSHH, Control of Substances Hazardous to Health, is a regulation that requires employers to control substances that are hazardous to health. Purpose: to protect workers from health risks associated with hazardous substances. Control the inventory. Ensure the chemical inventory register sheet is updated regularly to accurately reflect the current stock, including details such as chemical names, quantities, storage locations, and dates of receipt. Labeling and signage. Importance of labels. Safety helps workers and emergency responders quickly understand the hazards associated with chemicals. Compliance, required by authorities for labeling hazardous materials in containers. GHS Standard. Definition: the globally harmonized system of classification and labeling of chemicals, GHS, is an internationally agreed upon standard managed by the United Nations. Purpose: to standardize the classification and labeling of chemicals worldwide, replacing various national and regional systems. Labeling requirements. Pictograms, universal symbols indicating the type of hazard, e.g., flame for flammability, skull and crossbones for toxicity. Signal words, danger or warning to indicate the severity of the hazard. Hazard statements, describes the nature and degree of the hazard, e.g., causes severe skin burns and eye damage. Precautionary statements, provides advice on how to minimize or prevent adverse effects, e.g., wear protective gloves. GHS Hazard Classification Scale. Category 1, highest level of hazard. Category 2, high level of hazard. Category 3, moderate level of hazard. Category 4, lowest level of hazard. NFPA Standard. Definition: the National Fire Protection Association, NFPA, developed a labeling system to identify the hazards of chemicals and provide information for emergency response. Purpose: to enhance safety by providing clear and standardized hazard information on chemical containers. NFPA label components. NFPA Diamond. Description: the NFPA Diamond is divided into 4 quadrants, each representing a different type of hazard. Quadrants. Health hazard, blue indicates the level of health risk. Flammability hazard, red indicates the risk of fire. Instability hazard, yellow indicates the risk of chemical reactivity. Special hazard, white indicates specific hazards such as oxidizers or water-reactive substances. 2. Hazard ratings. Scale, each quadrant uses a numerical scale from 0 to 4 to indicate the severity of the hazard. 0. Minimal hazard. 1. Slight hazard. 2. Moderate hazard. 3. Serious hazard. 4. Severe hazard. 3. Special symbols. Examples. OX indicates an oxidizer. W indicates a substance that reacts with water. Labeling requirements. Proper labeling, ensure all containers of hazardous substances are labeled. Visibility, labels must be clearly visible and legible to all personnel handling the chemicals. Regular updates, update labels regularly to reflect any changes in hazard information or chemical composition. Training, provide training to employees on how to read and interpret labels. Monitoring, monitoring compliance with labeling requirements through regular inspections. Personal protective equipment, PPE. Types of PPE. Gloves, goggles, face shields, respirators, protective clothing, shoes. Selection of PPE. Hazard assessment, conduct a thorough assessment to identify the type of hazards present. Appropriate PPE, choose PPE that is suitable for the specific hazard and level of exposure. Example, use chemical-resistant gloves when handling corrosive substances. Fit and comfort, ensure PPE fits properly and is comfortable to wear for extended periods. Example, conduct fit testing for respirators to ensure a proper seal. Common wrong practices. Using damaged or expired PPE. Wearing PPE incorrectly. Using inappropriate PPE. failing to maintain PPE. Inconsistent use of PPE. Safe handling procedures. Where appropriate PPE, use gloves, goggles, and lab coats to protect yourself. Follow safety protocols, adhere to procedures for handling, storing, and disposing of hazardous chemicals. Seal containers properly, keep containers tightly closed to prevent spills and contamination. Avoid ignition sources, keep flammable chemicals away from heat, sparks, and open flames. Separate incompatible chemicals, store reactive chemicals separately to avoid hazardous reactions. Use approved containers, transfer chemicals only to approved containers. Utilize safe handling tools, use tools designed for safe handling to avoid direct contact with hazardous substances. Safe storage procedures. Proper labeling. Description: clearly label containers with contents, hazard symbols, and handling instructions to identify substances and understand associated risks. Example: label containers with chemical name, concentration, and hazard pictograms. 2. Segregation of incompatible materials. Description: store incompatible substances separately to prevent dangerous reactions. Examples: flammables and oxidizers, ethanol, flammable, and hydrogen peroxide, oxidizer. Flammables and ignition sources, gasoline, flammable, and sparks from electrical equipment. Acids and cyanides, hydrochloric acid and sodium cyanide. Strong acids and strong alkaline, sulfuric acid and sodium hydroxide. Concentrated acids and water, concentrated sulfuric acid and water. Organic solvents and corrosives, acetone and sulfuric acid. 3. Use appropriate containers. Description: store hazardous substances in compatible containers that are in good condition and have secure lids. Example: use glass containers for organic solvents and plastic containers for corrosive acids. 4. Temperature control. Description: maintain appropriate storage temperatures to prevent degradation or reactions. Example: store flammable liquids in a cool, well-ventilated area away from heat sources. 5. Adequate ventilation. Description: ensure storage areas are well ventilated to prevent accumulation of harmful vapors and gases. Example: use exhaust fans in storage rooms. 6. Regular inspection and maintenance. Description: conduct regular inspections and maintenance of storage areas and containers to ensure they are in good condition. Example: check containers for signs of corrosion or damage and replace them if necessary. Safe disposal of hazardous waste. Identify hazardous waste. Labeling: clearly label all waste containers with the contents and hazard information. Segregation: separate hazardous waste from non-hazardous waste and incompatible substances. Safe disposal of chemicals. Use approved methods, follow approved disposal methods for each type of hazardous chemical. Professional disposal services: utilize licensed hazardous waste disposal services for safe and compliant disposal. Dilution before disposal. Dilution guidelines: dilute chemicals to safe concentrations before disposal, if permitted. Sewage disposal: only dispose of diluted chemicals in the sewage system if it is safe and compliant with local regulations. Alternative disposal solutions. Recycling: recycle chemicals when possible to minimize waste. Neutralization: neutralize acids and bases before disposal to reduce hazards. Handling waste containers. Condition of containers: ensure containers are in good condition, with no leaks or cracks. Storage: store waste containers in a designated, secure area until disposal. Secondary containment: use secondary containment to prevent spills and leaks. Emergency procedures. General first aid instructions for chemical exposure incidents. Step 1. Stop the source. Remove contact: immediately remove the person from contact with the chemical spill, airborne particles, or fumes. Isolate area: secure the area to prevent further exposure to others. Step 2. Clear the lungs. Fresh air: take the person to fresh air to help clear their lungs of any inhaled chemicals. Monitor breathing: observe the person's breathing and provide assistance if necessary. Step 3. Flush the eyes. Irrigate eyes. Flush the affected eye with water for at least 15 minutes, occasionally lifting the lower and upper lids. Seek medical attention. Get medical attention immediately if irritation, pain, or discomfort persists. Step 4. Clean the skin. Remove contaminants. Brush off any water-activated chemicals, e.g., lime, from the skin before using water. Flush skin. Flush the contaminated skin with water for at least 15 minutes. Remove clothing. Promptly remove contaminated clothing and continue flushing the skin. Step 5. Ingestion. Do not induce vomiting. Do not induce vomiting unless directed by medical personnel. Rinse mouth. Rinse the mouth with water and seek medical attention immediately. Step 6. Seek medical attention. Immediate care. Always seek medical attention after exposure to hazardous chemicals, even if symptoms seem mild. Provide information. Inform medical personnel about the chemical involved and the nature of the exposure.
If you are exposed to a large volume of hazardous chemical, use the safety shower immediately. Pull the handle to activate the shower. Remove contaminated clothing, jewelry, and shoes. Don't let modesty slow you down. Every second counts. Another person may provide privacy by shielding you with a lab coat or other item. Remain under the water for at least 15 minutes to allow time for the chemical to wash off. In addition to chemical exposure response, emergency showers can also be used effectively to extinguish clothing fires.
When chemical exposure occurs, 1. Immediately move to an eye wash station. 2. Use either the paddles, levers, or pull lever to turn on the eye wash. 3. Hold your eyes open with your hands to ensure water reaches the eyes. 4. Flush the eyes for 15 to 60 minutes, depending on the corrosive qualities of the chemical. Be sure to keep the eyes open and rotate the eyeballs in all directions. And 5. Once flushing is complete, turn off the eye wash. Follow these guidelines for eye wash use. Never hesitate to use an eye wash if needed. Have a coworker contact emergency medical assistance immediately. If there is no one to ask, rinse for the allotted time recommended in the SDS and then seek medical assistance. If irritation persists, repeat the flushing procedure. Do not use lab or drench hoses as an eye wash. These hoses are typically used for cleaning and may not be sanitary. Never rely on sink faucets to replace an eye wash. Some outdoor eye washes may run discolored water for a few seconds. Never hesitate to use them immediately when needed. Do not use the shower for any other purpose that might inhibit the immediate use for an emergency. And beware of slippery floors during and after use.
Spill response. Step 1. Assess the situation. Identify the spill substance, determine the type of substance spilled, e.g., oil, acid, solvent, and assess associated risks. Initial risk assessment. Evaluate the potential hazards to people, property, and the environment. Step 2. Alert the appropriate personnel. Notify supervisors. Inform supervisors and relevant personnel about the spill immediately. Emergency response team. Contact ERT if the spill poses a significant risk. Step 3. Secure the area. Evacuate the area if necessary to ensure the safety of all personnel. Control access. Restrict access to the spill area to prevent further exposure. Step 4. Equip with appropriate PPE. Personal protective equipment, PPE. Ensure all responders wear appropriate PPE, such as gloves, goggles, respirators, and protective clothing. Check PPE. Verify that PPE is in good condition and fits properly. Step 5. Contain the spill. Use spill kits. Utilize spill kits containing absorbents, booms, and barriers to contain the spill. Prevent spread. Place spill socks and absorbents around drains and sensitive areas to prevent the spill from spreading. Step 6. Clean up the spill. Absorb and neutralize. Use appropriate materials to absorb and neutralize the spill. Dispose of waste. Collect and dispose of contaminated materials safely and in accordance with regulations. Step 7. Report and document the spill. Record details, document the spill, including the substance involved, quantity, response actions, and any injuries or damages. Report to authorities. Report the spill to relevant authorities as required by regulations. Unsafe practices. If you have any question, please contact the trainer directly. Training evaluation. You can scan the QR code, or you can find direct link in the description. Exam. You can scan the QR code, or you can find direct link in the description. Thank you.